I'm Dr. Sawhney with Divine Spine in Yorba Linda, California. And today we are going to be talking about how you can live this type of life where you can walk on the beach, enjoy your time with your family, run around with your grandchildren, and do all the things that you love and that you were created to do. But in order to do this, we need to answer 4 very important questions. Before we go into the body of our discussion and our topic, I would like to share with you a personal story of mine. About 12 years ago, I woke up and got up on the side of my bed, and I noticed that the chair that is in front of me was moving from side to side. And it was very bizarre. I felt very nauseous, very uncomfortable, and I felt like the room was starting to move around me as well. So I was fortunate at that time to work with a medical group in Santa Ana. So I called Dr. Gary, he's the medical doctor that I worked with, that morning, and I said, "Doc, this is exactly what's going on." He said, "Don't worry, come on in, we'll take care of it, let's figure out what's going on." So my wife actually took me down to the facility, and I got a full workup. It was wonderful to be able to work with the medical facility so they can try to figure out what's going on. And it just so happened that day that the neurologist that would come every 2 weeks was there that day. So I got a full workup. They tried to figure out exactly what was going on, did some tests, and I was prescribed a few medications that would numb the nervous system so that way the sensation that I was getting would start to decrease. And this was pretty bad. I mean, I couldn't drive the car. I felt very unstable, very nauseous, and it was very, very uncomfortable. I had no idea what was going on. So I took these medications, and what they did for me was they made me very drowsy, very sleepy, and I was able to actually function even less. So that wasn't working. And so I went back to our neurologist, gave him a call, and I said, "Hey, I've tried the medications, they're not working, what's the next step?" So he referred me to an ear, nose, and throat specialist. At that time, I went ahead and I made the appointment, went into this wonderful doctor where he did his examination and recommended that I get a CT scan with contrast of my head to figure out what's going on. I got the CT scan done, went back and got the results of that CT scan. And the results were negative. They couldn't figure out from that scan what was going on. So the doctor had an idea. He said, "Let's go ahead and do an exploratory surgery." They were going to open up my right eardrum, and he suggested we're going to go ahead and send in a camera and a probe, and if there's anything that they see, they would either cut it out or they would cauterize it. And the issue was that he also explained to me the side effects that were potential from this procedure. One of them being that I would potentially lose partial or all of my hearing in my right ear, and in the unlikely event there was an infection, that I could get brain damage. That was what was explained to me. It was that moment where I realized the answer to the first question. What is our most valuable asset? It's our health, right? It doesn't matter what stage you are in your life. If you're coming out of college, if you're going into retirement, you need your health. Think of a goal that you have 5 years from now. Sure, you're going to need to spend some time, some money, and some effort on achieving that goal. But one thing that you're absolutely certainly going to need is your health. So I'm sure we can all agree that our health is our most valuable and our most supreme asset. So that takes me to the second question out of the 4, which is, what is health? What is it, right? Because if I were to ask most people what they believe health is, most people would base their health on how they look or how they feel. The problem with that is that you can actually miss some of the biggest killers in our country. You can't just base your health on how you look or how you feel. Think of somebody that has been diagnosed with cancer. We all probably know somebody that we care about or a relative to us that has had cancer, right? And so we've talked to people that have been diagnosed with stage 4 cancer and didn't even know that they had it. Think of somebody that has heart disease, right? You don't always have warning signs of heart disease. In fact, 33% of the time, when someone has a heart attack, they actually pass away. And the heart attack can come as a surprise. So you can't always base your health on symptoms. Symptom, by the way, is when you feel bad or look bad, right? And when you have a symptom, typically what we do is we go to the medical doctor, which is great, but sometimes if it's like a headache, neck pain, back pain, even sciatic issues, a musculoskeletal issue, we get prescribed a pill. And if that pill doesn't work, we're prescribed another pill. And if that doesn't work, then we get a surgical consultation. Well, I'm going to share with you the definition of what health is according to the World Health Organization. They have a definition of health. And the definition is health equals 100% function. That is the definition of health, 100% function. So if health is 100% function, what controls all function? It's our brain. Our brain and our spinal cord make up our central nervous system. And our central nervous system controls every single organ, cell, and tissue in our whole body. And our brain is housed and protected by our skull. Our spinal cord is housed and protected by our spine. It's the only system, because we've got different systems in our body. We've got the respiratory system, digestive system, cardiovascular system, and then you've got your nervous system. It's the only system in your body that's fully enclosed by a bone. Why? Because it's the most important and it's the most delicate. So this innate wisdom that we all have that flows from our brain down our spinal cord into every single organ, cell, and tissue in our body, this is the same power that helps us to wake up in the morning. It's the same power that told us to nurse when we were babies, okay? This is the same power that can heal, that can help your body actually heal a fracture, okay, once it's casted. This is the same power that heals a cut on your finger, okay? If you have a cut on your finger, you look at your finger 2 weeks later, if there's no infection, the cut is healed, right? How did that happen? Your body did the healing, right? This is the same power that helps us digest our food when we're having a conversation. We don't think about so many things and our body just has this function. Well, that's coming from our brain. So one of the biggest things that can impede the function of our central nervous system is a subluxation. What is a subluxation? In your spine, you've got several bones. You've got 7 in your neck, 12 in your mid-back, and 5 in your low back. If any of those joints in your spine are either out of alignment or just stuck and not moving, and then it interferes with the flow of the nerve, that is considered medically to be a spinal subluxation. Sub, which is less than, lux, light, okay? So when there's a subluxation in your spine, that's like a dam in the river of that information that flows from your brain that goes to wherever that segment is. So if I have a subluxation somewhere in my neck, that could cause pain down the arms. It could cause ringing in the ears. It could cause headaches. If I have something going on in my lower back, for example, right? That can cause pain going down my leg. That can cause numbness or tingling, perhaps weakness. It just depends on what level that subluxation is, okay? So if we have a subluxation in the spine somewhere, a joint that's out of alignment, locked up, not moving well, imagine if I take enough ibuprofen or Vicodin. Do you think that can take care of that subluxation? No. If I exercise, if I do yoga, if I get a massage, can it take care of that subluxation? No. It's a mechanical issue. And a mechanical issue requires a mechanical solution. That subluxation needs to be adjusted. At our office at Divine Spine, we have a technology that we can give you an adjustment in your spine without any twisting, any popping, any cracking. We use our EVA adjustment system, our electronic vertebral alignment. It's a gentle oscillating percussion which can eliminate and remove and restore function to a joint, remove the subluxation, and allow that nerve to flow freely. So going back to when I was with my ear, nose, and throat specialist, I was presented with this option of having exploratory surgery, which was, for me, absolutely devastating. We had just had my daughter. My son was just over a year old, and I was just in the beginning of my career, and the idea of being partially deaf, possibly permanently deaf in 1 year, and having another complication of the risk of brain damage was absolutely devastating to me, and it didn't seem like a good option. So I had hit a low at that point in my life because I didn't have my health, and I didn't have the right answers. I didn't know what to do. It was that time where I had connected with a good friend of mine all the way up from Canada. And so Dr. Gauba, one of my close friends, he had suggested that he had asked me, he said, has anyone properly checked your neck? And that's when all sorts of light bulbs started to go off in my mind. I said, no, because we've done all these other scans and blood work and all this stuff, but no one has ever checked my neck. So he had recommended me to see a non-surgical spine specialist up in Newport Beach. And I went to this doctor, and he had taken x-rays of my neck, a couple of different views. And in those x-rays, we had found together a postural subluxation in my neck. You're supposed to have a 45-degree curve in your neck. I was not only missing the curve, but my curve was going the other way, in the wrong direction. It was a reversed curve syndrome. And the nerves that were coming out of the top section of my neck, the first 3 vertebrae, the ones that go to your inner ear, those were the ones that were problematic. So he had found what he had believed was the root cause of my issues and my problem. So with care, addressing the root cause of the problem, within 4 weeks, the symptoms that I had started to disappear. I was able to go to work again. I was able to function. I was able to play with my kids. I had felt like I had been given my life back. And I was so grateful, I was so thankful that this doctor found the root cause of my problem. The fourth and final question that we must all ask ourselves is, when is the right time to be proactive with your health? And the answer is now. Your health is something that you should always be proactive with, not reactive with, as many people are. So if you have a health issue and you've tried multiple solutions and you still have the problem, chances are you haven't found the root cause. Come to see us at Divine Spine for a complimentary consultation, and we will try to find the root cause of your health issue. And if we can't find it and we can't help you, we will be happy to refer you in the right direction where you can actually get some real help. With health, it is your most important asset, and we want to be proactive with our health. And the reality is that participation equals transformation. So my advice, participate in your health. Eat great food, exercise 3 times a week for at least 30 minutes, and if you have an issue with your spine or your nervous system, come and get it checked. It is always the best thing to do, is to be proactive with your health.